My insurance denied my MRI because I didn't have 6 weeks of physical therapy.
I had another patient come in and share with me that United denied her inpatient stay.
I actually read this morning about a bill that's being proposed to be passed to give AI the ability to prescribe medications. I mean, yes, I know we're headed in that direction eventually. Doesn't that seem just a little bit dangerous?
I'm in so much pain. I was trying to tell the doctor that today, and I have to wait for insurance.
It was in reference to using AI to triage patients in the emergency department.
Hey, just a reminder that you can't fix understaffing and equipment that doesn't work with AI.
It seems there isn't an industry where AI isn't being used. CEOs claim that AI makes everything so much more efficient, when the reality is they're just saving money because they don't have to pay as many human workers, and therefore the CEOs pocket that savings. When I was making the video about Palantir, I came across something that shocked me. Executives were bragging about how their AI agents were transforming insurance underwriting. Underwriting being the process of where these companies effectively assess your risk and decide if they want to offer you some type of coverage or not. What used to take humans 2 weeks to decide now only takes AI 3 hours. Alex Karp, the CEO of Palantir, said something that should terrify all of us. They're now using their AI to process claims and call for prior authorization. Then he said this.
There's places you would use certain models, but not others. How do you bring that back to your corpus of truth to understand in a lethal context who dies and who doesn't? And you have very similar use cases in underwriting and in healthcare.
He's referring to an AI deciding who gets treatment and who doesn't. After making that video, I couldn't stop thinking about what Alex Karp had said, and so I wanted to look at the healthcare industry more. How are they actually using artificial intelligence? It's darker than what I thought. Insurance providers are using AI to assess you and provide you with some type of policy, but they're also using AI to set the price. And then when you actually need care and you go to use the insurance you've been paying for, they use another AI to effectively determine if it's medically necessary, whether they will approve your claim or not. And according to multiple lawsuits and investigations, these AIs are designed to do one thing: deny as much as possible. Let me tell you about Gene Lokken. Gene was 91 when he fell and fractured his leg. His doctor said he needed months of rehabilitation. After just 2.5 weeks, United Healthcare cut off his coverage. The AI had decided he'd had enough care. His family was forced to pay $14,000 a month out of pocket while fighting for the decision. Gene never saw the resolution of this case, but according to multiple lawsuits, this isn't a glitch. This is how the system was designed.
He states that it's not medically necessary treatment.
That was an internal phone call between two United Healthcare workers. They're laughing about denying someone's insurance claim. We're ProPublica, a nonprofit newsroom, and we investigated. The person they're laughing about is Chris McNaughton. He was in college when he was diagnosed with ulcerative colitis, a chronic autoimmune disease. It took him a really long time to find meds that put his disease into remission. But when he finally did, United flagged Chris's case as a high-dollar account. Ultimately, United said it wouldn't pay for his medicine because it was not medically necessary.
Think about what's happening here. A machine is looking at our data to assess our risk to the company. Then another machine is setting us a price for this policy, effectively using AI dynamic pricing. Then another machine determines, is the treatment prescribed by our doctor medically necessary? And if not, then it effectively denies it. And according to Palantir's own CEO, somewhere in that corpus of truth, the AI is determining who lives and who doesn't. Before you receive any type of treatment, you need what is known as a prior authorization. Healthcare insurers claim this is a way for them to make sure doctors aren't prescribing something you don't need or some type of treatment that's not necessary. Yet doctors and physicians in the industry claim this is just a denial machine.
Let me read you an insurance denial letter that I just got. Use of the requested drug is only approved for the treatment of certain medical conditions. Your doctor has not indicated that you have a diagnosis of either mild to moderate atopic dermatitis that affects less than 20% of your body. Let me go to her notes. In my note, diagnosis, atopic dermatitis, total body surface area, 10%. Do you and I agree that that's less than 20%? The denial letter says that I did not document that. So clearly, insurance companies are not reading my notes.
So here's how it actually works. Your doctor submits a request, but it doesn't go to a medical professional right away. It goes to an AI. This AI pulls from years of data on millions of other patients. It reviews your medical information submitted by your doctor. Then it makes a decision on whether or not the medical treatment suggested by your doctor is medically necessary. Your doctor could recommend 42 days in a rehabilitation center, whereas the AI, based on all of its data and predictions, determines that you actually only need 14 days in rehabilitation to recover.
I had another patient come in and share with me that United denied her inpatient stay. One of the criteria that this insurance company used to decide whether or not to accept or deny this request was whether it's medically necessary. And it's so interesting that we're letting insurance companies and the doctors who work for insurance companies determine what's medically necessary, and not just the doctor in front of the patient in the emergency room. So this is a really bold statement from United for my patient. They say, you did not have to be admitted as an inpatient to the hospital for this care. I think we all need to just reflect on that. An insurance company is telling a patient and her doctor that they disagree with the plan of care to keep that patient safe. I know that this is boiling down to whether it's an inpatient admission or an observation admission, and that's really about money. But what I want to point out to you is they're making medical decisions. This insurance company is actually weighing in and disagreeing with a doctor who made a medical decision to admit this patient for her safety.
Now, you can appeal these denials, and this can lead to your doctor having a peer-to-peer conversation with the doctor that is employed by your insurance provider. But the evil part of this is that often these doctors that work for your insurance provider will just side with whatever the AI determined. It's a doctor you've never met before deciding your treatment based on whatever prediction the AI made.
This is Dr. Elizabeth Potter. Who is this? I'm good. Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty. So you're an oculoplastic surgeon. What was your initial training in? So we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct? Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. So do you perform lymphovenous bypass? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? You have not.
But what a lot of people don't know is that their insurance provider isn't even making this decision. They've outsourced that decision to another company that has built AI to make the decision for them. Meet EviCore and NaviHealth. They're the hidden AI companies controlling healthcare for over 100 million Americans. Both of these companies started out as independent firms developing AI that was efficient and data-driven. They promised insurance companies that by using their AI to manage claims, they would see an incredible return of 3 to 1, meaning for every dollar spent on EviCore, the insurance provider would save $3 on medical care. Insurance providers loved these AI denial companies so much that they bought them. Cigna owns EviCore, UnitedHealth owns NaviHealth. This effectively means that insurance providers now own the AI that determines what level of care you receive, if any. Since they own it, they can go in and tweak the system if they want to deny more or deny less. And according to investigations, that's exactly what they've done. As reported by ProPublica and former EviCore employees, the company uses something insiders call the dial, an AI-backed algorithm they can literally adjust to increase or decrease denials. A former EviCore executive confirmed, "We could control that. That's the game we would play." When insurance companies want to cut costs, they don't have to get their hands dirty. They just tell EviCore to control the spend, and they know exactly what that means. EviCore salespeople have boasted of a 15% increase in denials. This is exactly what Alex Karp meant by who lives and who doesn't. Now let's talk about United Healthcare, which I think we're all familiar with. They are the largest health insurer in America, covering 52 million people. They use an AI system called NH Predict. According to a class action lawsuit filed in Minnesota, this AI has a 90% error rate. But in my opinion, this isn't an error. The system is functioning exactly how it was designed because according to the lawsuit, only 0.2% of people appealed denied claims. The companies know most patients lack the knowledge, resources, or simply the time to fight back. Appeals can take up to 2.5 years. Seriously ill patients may pass away waiting on their appeal process. According to the American Medical Association, more than 1 in 4 physicians, around 29%, report that prior authorization has led to a serious adverse event for a patient in their care. The AI isn't getting better at making medical decisions, it's just getting better at denying people. And you may wonder, surely a doctor can override the AI. And they can, but it rarely happens. According to the lawsuit, United Healthcare allegedly terminates employees who deviate more than 1% from what the AI predicts. Think about that. If the AI determines that you get 14 days of treatment, but a human wants to override the AI and say that you get 15 days, they could be terminated. At Cigna, it's even more blatant. According to a ProPublica investigation cited in multiple lawsuits, Cigna doctors denied over 300,000 payment requests in just 2 months. The investigation found doctors spent an average of 1.2 seconds reviewing each claim. 1.2 seconds. A former Cigna doctor told ProPublica exactly how it works. We literally click and submit. It takes all of 10 seconds to do 50 at a time. In my opinion, this is just greenlighting whatever the AI says. No humans needed. Just let the AI do it. But perhaps the most insidious part of all of this is that these companies have developed what EviCore executives call Sentinel effect. Doctors simply stop asking for procedures because they know they'll be denied. In Vermont's Medicaid program, cardiology requests dropped 38% after EviCore took over, not because patients got healthier, but because doctors just stopped fighting. Rightfully so, doctors now refer to EviCore as EvilCore. I feel I should also explain what's happening with Medicare, because after all, it affects all of us, your parents, grandparents, and eventually you. If you're unfamiliar, Medicare is what you pay into every paycheck. It's the government-provided healthcare that you get when you reach retirement age. There's no AI, no prior authorization for most things. Now, you may have heard of Medicare Advantage. These are essentially private companies, so think UnitedHealth, Humana. They're like a middleman. They sit between you and the government. They use celebrities like Joe Namath and William Shatner to convince people that there's more benefits out there that they're missing out on. But the moment these seniors switch to something like Medicare Advantage, they're now dealing with a private company who is deploying these artificial intelligence to effectively deny treatment. Now, there's a reason why I brought up Medicare and Medicare Advantage and explained the differences, because I wanted to highlight that for the most part, Medicare has not required prior authorization, but next year for certain procedures, it will require prior authorization. Essentially, the US government is now working with artificial intelligence companies to do a test pilot in 6 states. They're trying to eliminate waste, but I want to remind you that this is money you've paid in over your entire life so that you have healthcare treatment when you reach retirement age. We don't actually know which AI companies the US government will work with, but based on the specifications, it has to be a company that has prior experience with this type of AI claims. So that leads me to believe it will be one of these companies we've been discussing, perhaps even EviCore. Now, you may be wondering, how will these AI companies be paid? And this is the most evil. I don't even know. Honestly, I don't know. These companies will be paid a percentage of the money they save. Think about what that means. The government will reward companies by having them receive a percentage of the savings associated with averted waste. They're literally incentivizing these companies to deny healthcare because that's how they're going to make money. Make it make sense. I mean, soon everyone from 18 to 65 is going to be filtered by an AI. The same AI that has a 90% error rate and has a review of 1.2 seconds. When I make these types of videos, I often wonder, how is this legal? And in some cases, it's not, whereas in other cases, yeah, it kind of is because of loopholes. But in terms of using AI to deny, that's actually illegal. And there's been a lot of lawsuits. Yet it's never enough for these companies to not do what they're doing. The state of Connecticut found that EviCore had 77 violations, and they fined the company $16,000. Not $16,000 per violation, $16,000 total. That's it. A company valued at $67 billion after Cigna purchased it, keep in mind. Meanwhile, these companies project to make millions into the future, probably from denying claims, yet they get fined just $16,000. I read that a lot of patients don't even realize that they can appeal these denials. And that's exactly what the insurance providers are banking on. They're hoping that these patients feel overwhelmed by the situation, that they don't have the time, the resources, or the understanding that they can appeal. They're hoping that these doctors don't advocate for their patients. But I want you to know that you can appeal these denials. And actually, a lot of people are using generative AI to do so. Effectively, they're fighting AI with AI. And surprisingly, this is one use case of generative AI that I can get behind, because it can feel very overwhelming by medical jargon and even perhaps legal jargon to appeal these denials, and AI is allowing people to do that. So please appeal your denials and prove them wrong.